Good afternoon. I am here with Miss Navi. She is a 5-year-old American Pit Bull Terrier, and she's going to be my model for the wood element points. And we're going to be looking at the liver points, which is the yin organ, and the gallbladder points, which is the yang organ. Now, normally you start with the yin. I'm going to start with the yang because it's easier, because I'm going to start up by her head and work my way down. So the first point we're going to talk about is gallbladder 20. And it is behind the ear, so you run your finger along the back side of the ear, and then boom, you're going to fall into a spot. And that is gallbladder 20. It's good for free flow of chi. It's good for head and neck pain and stiffness. It's great for relaxation. We're going to keep going down the gallbladder channel to the next point. It's gallbladder 21. Also good for free flow of chi and can help with local shoulder issues. Now this point is on a muscle. It's actually, you'll feel, it's almost got like a golf ball, a ball feeling to it. You can kind of see me rolling around my finger on it. It's about midway between the spine and, well, shoulder. So it's about midway across here, and then you'll feel that bump, and it is right there. It's in front of that scapula, really. It's or cranial too. So it's on that big muscle bump. Now you'll see I'm kind of moving this point to go to where that is, because when I did this, she was standing, and dogs have movable skin, so it kind of moves around a little bit. So I have to kind of adjust it sometimes. And then now we're going to have the gallbladder channel, which goes down across the body, so over lots of joints. And the next point we're going to talk about is gallbladder 34. That is the influential point for sinews, which is going to be tendons, cartilage, ligaments, fascia, all that stuff. And that is actually, here's your stifle joint, and you go across, and there's a big divot in about the center on the outside between, you can see this bend of the leg and then the stifle joint. And this spot, you can see if I go down and my finger falls into it. When they're standing, or in some dogs, it's extremely noticeable even without knowing exactly what you're looking at. There's usually, you can see a large divot in that area, and that is gallbladder 34. We're going to keep going down the gallbladder channel. Here we come to gallbladder 41. That is the opening point for the girdle channel. And you have your hock joint here, and then you have all these tarsal bones. And then this is the 5th metatarsal, or the fifth toe. And it's past these little bones. You just feel some bumps, and then boom, there's like a divot you'll fall into that's on that 5th metatarsal. And that is gallbladder 41. And we're going to keep going down to the ting point, which is gallbladder 44. And that is actually on the lateral side of the 4th toe, right at the nail bed. So on all dogs, you're going to pretend that they have dew claws on the fronts and backs, even if they don't. And that would be the 1st toe. So then 2nd, 3rd, 4th, and then 5th. So that's 2nd, 3rd, 4th, and 5th. So it's important to remember. So now the ting point for the liver channel is on the lateral side of the 2nd toe, right at the nail bed. A lot of dogs will not allow this to be done, just being excellent. And you go up the liver channel now, and it might be easier to show on this other leg. So this is about where your dew claw would be, and if you roll in right in between the 2nd and the 3rd metatarsal, there is a spot right in between those at about where a dew claw would be, and there's a point, and that's liver 3, and there's a source point for the liver meridian. And now liver 8, which is a very powerful water point, is actually up inside. I'm not sure which is the easiest way to show it, but here's their stifle joint. It's actually inside. You've got your femur that comes down here, which connects to the tibia and fibula, well, or their version of it, and that's your stifle joint. So here you're gonna have, this is, you have one femoral head here, and it's kind of back behind that, and there's a big divot. It's about centered. You see, boom, it's like behind that. I don't know how easy this is to see. It's back there. It's about center. Here's that big head, and then here's the stifle joint coming where they come together, and it's inside there. Boom. And then I'll try to show it on this side, but it's not so easy. It's inside, in the center, kind of in the middle. And then last, we're going to have the liver 13, which is the spleen alarm point. And that is actually, here's your ribs. So here's the edge of the ribs. And you're gonna feel this, the last little floating rib is where they kind of turn. So that's the bottom edge of that floating rib, which is actually a different, it's gallbladder 25. We're not going over that, but random facts with Jess. And then down here is going to be, you go around that and then you hit the edge of that next rib, and that is liver 13. Now there is some debate. Some people say it's a very big point. You kind of just put a hand on it, or there's some debate. Some people think it's a little lower, or I go here, and that's where I usually have the best results with animals. And I also marked on her the shoe points, which we'll be going over in later, but I will show you since they are actually on the dog. And of course she's laying down. Yes, good girl. So when you're going for, on the bladder meridian, you're gonna have a liver point and a gallbladder point. And on a dog, dogs are different. For her, it's about like 2 fingers off her spine, 1.5 fingers maybe. The bigger the dog, the farther off. The smaller the dog, it's gonna be closer. And to find the liver point, you're gonna count up 3 ribs. So 1, 2, 3, and then follow it up. And that's gonna be bladder 18, so your liver point. And then it's count up 2, so 1, 2, follow that up. And that is bladder 19, and that is the gallbladder point.